Liu, welcome. I'm going to hand it over to you for the presentation, and I'm very excited to hear what you have to say about this topic.
Right. Thank you so much for having me. Good afternoon, everyone. I am a behavior neurologist by training, and I've developed an interest in headache in my clinical practice, and particularly in the past few years with the development of new CGRP blocker therapies. Primarily, as a behavior neurologist, I'm always interested in how behavior arises in the brain. And the headache, especially migraine, has a lot of interaction between headache and behavior, certainly headache and memory. And so we're going to talk a little bit about that today. And so I think people with migraine and many doctors who train migraine are beginning to see migraine as a syndrome, not just a headache itself. It is to be treated as a whole. So when we start to pay attention to the non-headache symptoms around the headache episode, we realize these non-headache symptoms, including cognitive difficulties, can be equally debilitating, if not more. Today, in the next 30 minutes or so, we're going to have a discussion about migraine and brain fog. And so, first of all, we're going to move on to the next slide, please. So we're going to talk a little bit about what kind of define what brain fog is, what symptoms are considered to be part of brain fog, and also, in the setting of migraine. And then we're going to discuss a little bit about this phenomenon called cortical spreading depression that has been scientifically thought to be the kind of basis for the brain fog, at least in migraine. And so let's move on to the next slide. So when we talk about brain fog, a lot of people with migraine already have experienced this. It's basically a kind of mental fatigue. Everything takes a little bit more effort to do, difficulty paying attention, and trouble multitasking. That's a very typical one. Where you cannot really divide and move your focus from one thing to another as quickly as you would otherwise without the brain fog. And a lot of disorganization, difficulty remembering, from going from things to things. You're not as sharp, you're not as fast as you usually are. So your productivity is down. And in some cases, you might have difficulty communicating, and that we know can be a part of the migraine syndrome for sure. So all these things are considered together to be brain fog symptoms. And certainly that applies to brain fog in migraine. So, when we study the brain, typically starting with, mouse model, we look at the brain and kind of what can be the explanation or the physiological basis or pathological basis for the brain fog in migraine. And scientists have studied this and look at this phenomenon called cortical spreading depression. And it is defined as a sort of a calcium wave or a wave of brain activity that spreads throughout the cortex by way of the neurons communicating directly through some unique channels called gap junction. And the spreading of a calcium wave that goes through the neurons and kind of communicating locally with the neighboring neurons. And so this phenomenon can occur when the person has a migraine or before the headache starts. And so when this happens, then the brain gets excited by the wave, and then it has a period of depression, we call it. This is not a kind of emotional state or psychiatric diagnosis of depression, but rather the brain's activity is depressed after this wave of activity spreading through the brain. And so we thought that this might explain why people have what we call prodrome, or feeling of malaise or fatigue or brain fog in this case, we're talking about, before the headache actually comes, and certainly after the headache is finished. And so these are quite typical for a lot of migraineurs, especially people who have migraine that is considered to be chronic or more than 15 days per month. And this can be a quite persistent thing, perhaps even more debilitating, more interfering with daily function and job performance than the migraine itself. Okay, so let's go to the next slide. So when we come to understand brain fog and migraine, typically we think of it as this feeling of mental fatigue, difficulty focusing, typically in what we call the prodrome or the premonitory phase, or the first phase showing here. There's a lot of different symptoms also listed here that you might not be able to see so well, but I put a red arrow there indicating where we typically think of brain fog during the migraine, the 4 phases of migraine. But that's not to say that you don't have this during the second phase or the third phase, just that during those phases, the aura and the headache itself kind of take center stage. And so you typically think of it, of course, I'm out of focus because I'm having a headache and so forth. But, what is not known to a lot of migraine perhaps is the prodrome and the postdrome. So these periods can be quite long, can be a couple of days. And in terms of, in the case of chronic migraineurs, it can even last, several days in a row, and then you have another headache, it starts over again. So you can have brain fog almost constantly. And that can be, as you can imagine, quite debilitating. Okay, so let's move on to the next slide. So people have looked at brain fog and tried to see what medication might be helpful. And of course, given the underlying explanation or the pathophysiological explanation for it, which is the cortical spreading depression, people have looked at that. And to see, scientists have looked at that, see how we can, what substance or chemical or medication can suppress that. And currently there is really no, a medication that we said that is highly effective specifically to treat the brain fog. But we think that if you manage the headache portion with all the therapies we have, you minimize the risk of having brain fog, or you can reduce the days of brain fog just by doing that. So that makes sense. That's pretty understandable. But in addition, if there is persistent brain fog, then we look at, is there any medication that might be helpful? So here I'm showing a couple of medications that's on here that is thought to antagonize or to stop the cortical spreading depression. And one of the medication that has been kind of controversial or been discussed is the medication that's used in Alzheimer's disease called Namenda, or in this case, the generic name is called memantine, in the right lower corner arrow there. And so, so this medication is known to suppress this cortical spreading depression. So that's sort of the basis or the explanation for its effect in some patients who see improvement in brain fog, probably because of this suppressive effect. And on the left-hand side, the arrow is pointing to a medication that's typically causing brain fog, or maybe not causing brain fog, but just a sense of mental slowing and fatigue. And so you can see that the chemicals that suppress the cortical-sparing depression, in this case, the topiramate or Topamax here, it's really kind of nuanced. So it's not that you just give a medication and then you can lift the brain fog. It's more like, what are we doing exactly to the physiology? And so in this case, the Topamax is thought to be suppressive of the aura that is cortical spreading depression. We said that aura also has cortical spreading depression as its basis. And so, so in this case, topiramate is used in that way, but if too much of it, then it becomes that it has that side effect of slowing down the brain too much. And so if you go too much, if you go too far, then you will have the opposite kind of paradoxical effect of actually slowing down mental activity. And so, but topiramate by itself also has a lot of, or Topamax by itself has a lot of other side effects. So the therapeutic window and also the side effect, window in terms of the dose can overlap to a point that it's not an effective medication. So it's good that we have other medications, such as CGRP blockers and so forth to help with this issue. But here is just to show you that a lot of chemical has been tried to suppress the cortical-sparing depression, and not necessarily, that if you suppress it, that it will necessarily lift the brain fog. So it's a quite complex kind of issue and pathophysiology. Okay, so that's kind of the basis for the brain fog explanation. We will answer your questions after this short presentation here. And another aspect of migraine that probably has not too much to do with cortical spreading depression, or maybe it does, is what we typically see on the MRI of several dots in what we call the white matter. And these things accumulate as the person's migraine history is prolonged, and they're thought to be associated with inflammatory damage to the very tiny vessels in the deep part of the brain. And it seems to be more frequently seen with people with aura. So on that basis, you can say that the cortical spreading depression might have something to do with this kind of presentation. So basically, cortical spreading depression leads to inflammation. Chronic inflammation leads to damage to the tiny vessels that is showing up on the MRI. Okay, next slide. So then the key question a lot of people are interested in is whether there is an association between a headache in general or in migraine and dementia. So it's been controversial, but more recent data with quite a large database is showing that there in fact is a correlation, or there is a strong suggestion of association, I should say, that people with a history of migraine were 3 times more likely to have dementia down the road than people without dementia. And then specifically people with Alzheimer's disease, if you look at people who already have Alzheimer's disease, they're 4 times more likely to have a history of migraine disease. And but what's interesting is that there is no correlation in studies between the history of migraine and what we call vascular dementia, which is another type of dementia that's different but can overlap with Alzheimer's disease. So we look at the MRI on the last slide that perhaps there is damage to the small vessels. So there might be a vascular reason for migraine to develop dementia, but it doesn't seem to be significant enough to lead to what we call vascular dementia, which is primarily due to vascular compromise rather than the Alzheimer's disease. And so, and what's also interesting is that as people study the tension type headache, and there is no apparent risk of that with Alzheimer's disease or vascular dementia. So it seems like the migraine and chronic migraine, specifically with neuroinflammation and chronic neuroinflammation, seem to be a risk for later on developing Alzheimer's disease. Okay, let's move on to the next slide. So then, given the risk, we want to learn how we can best prevent dementia. And whether you're a migrainer or not, I think all these things help that I'm showing here, that we typically hear about, cognitive health maintenance and also kind of a program, lifestyle modification. These things can really lower the risk of dementia in general. And there is no specific or good set of data specific looking at migrainers prevention in terms of getting dementia further down the road. But I think it does make sense that whatever works for cognitive health in general should work, well for migrainer, as well. So if we look at here, the major ones are sleep, diet, and exercise. And certainly, being socially active over time, and you maintain that in later stages of life, very, very important. And we see that during the pandemic pandemic time, that a lot of older folks have been isolated in their residence, and they deteriorate rather quickly in that setting. So social interaction is very, very important. And other areas in terms of quit smoking and stress reduction and so forth. These are all key areas, and we don't have, we're not going over them today due to lack of time, but we can answer questions about them later. Okay, that's the presentation.
That was really interesting and super helpful. Dr. Liu, I really appreciate that. I've already had some comments about, is this going to be available afterwards? So yes, we are putting this up on our YouTube channel, and you'll be able to, see the presentation there with the slides as well. So, that's hopefully going to be helpful to some people. So we already have a lot of questions that were given to us earlier in the week. So we're going to try to get to those, but for whatever reason, I'm having trouble. There we go. Okay, trying to get out of the PowerPoint presentation is a little bit challenging, so I can see everybody's questions, but I think I've got it up now, so we're good to go. So the first question I have is, can brain fog and cognitive changes be caused by the traumatic nature of migraine versus the physiological changes? So just the stress of constantly, having pain and dealing with the unpredictability of migraine. Is that something that can also cause brain fog?
Yes. So brain fog is thought to be related to the cortical spread depression, but that's probably not the only mechanism. And so in terms of the changes, inflammation itself, if you're talking about episodic migraine, where essentially you don't have brain fog on days you don't have headache, people don't usually talk about brain fog because they kind of chalk it off as part of the migraine. When you have headache, when you have any kind of pain, you can't concentrate, let alone, pain as severe as migraine. And so in that sense, you can say that, okay, the episodic event causes inflammation, but the inflammation it doesn't continue. And so, so then, you really don't have a a sort of a injury over time to the
Right.
brain. But if it becomes chronic, or what we think is that, when it becomes chronic, is that the brainstem area becomes very sensitized to multiple triggers you might not even know. So that's why you
Right.
keep having it every day. And in that setting, you have chronic inflammation, and then that can cause injury, including to the vessels, including to, mainly to the vessels, but probably to the brain itself.
Yeah, absolutely. And I think that's a great answer. And thank you for that. We had another kind of similar question. So it was from someone who said they've had migraine for 70 years. 2 years ago, they became a widow, and they've discovered like a compounded brain fog from grief. Now dealing with long COVID on top of that, an additional brain fog. So the question is, are these completely different types of brain fog and cognitive changes, or are they the same? And they're just compounding on top of each other. Obviously, it's like you said, the cortical spreading depression is something different, but do these things, do they just build on each other when things like this happen?
Right. It's very likely that there's a central theme here, which is neuroinflammation. And so we already know that in long COVID, there's continued, inflammatory marker, for example, in the CSF and so forth, and even, Alzheimer's disease proteins accumulation that might be accelerated. And so seems like, whenever you have an infection that is prolonged, or even if there is, dormant, COVID-19 virus in the body that is continually to cause inflammation in not just the brain, but the entire body, but certainly in the brain, then you can imagine that that can lead to brain fog as well. Whether that has anything to do with cortical spreading depression, that we don't know that
We
at
don't know.
this time.
Right.
So it can be compounded for sure. So we always want to be very careful about, about neuroinflammation, things that can cause inflammation. If you can, we'll talk about, anti-inflammatory diet often, and other things, and supplements that potentially can put out the fire, so to speak, in
Right.
long COVID. And so, yeah, so it might be a different process, but with a central theme of neuroinflammation.
Right, that absolutely makes sense. And then, doing another follow-up question on that, what is it that happens during menopause that causes brain fog, menopause and perimenopause?
Mhm. Okay, so that is a perhaps a different a mechanism, and so hormonal changes that as we know through our life, as such as the onset of menses, and also menopause, and the hormonal changes during childbirth and so forth in women. So these by themselves can change migraine, and people have known that for many years, and uh, sometimes for the better, sometimes for the worse. And so it's not known that the menopausal worsening of a headache or brain fog then is doesn't seem to be related to cortical spreading depression, because there is a waning of estrogen. Estrogen, we know that or the spike of it can cause cortical spreading depression.
Okay,
And so that's
interesting.
why
Okay.
2 days before the onset of menstrual cycle, a lot of women with migraine will start to have headache before then. That's thought to be related to the spiking of the estrogen. So when you're in menopausal phase, then it seems like it's going the opposite way, and the brain fog then could it be caused by cortical spreading depression? Maybe, but we just don't know. But certainly just the hormonal changes in other ways can
Right.
make you feel like you have
Right.
or similar symptoms as the brain fog you get usually with migraine.
Yep, that makes a lot of sense. Thank you for that. We have several questions to do with medications. And again, just to remind people, if you have questions, please put them in the comments. We will do our best to get to them. We have about 15 minutes left, and a lot of questions to go through. So I noticed on the display where you were talking about memantine or Namenda being the brand name, that's a non-competitive NMDAR antagonist. But I also saw under the same list as memantine was ketamine and magnesium. So are those two medications that, well, obviously magnesium is a supplement, not a medication, but are those two products helpful in cortical spreading depression and treating this? And if in the case of ketamine, is there more evidence for the infusions versus the nasal spray, or we don't know yet?
Yeah. The quick answer is that we really don't know that yet. And even with Namenda, this is more of a a way to explain that that people get better. Some people, anyway, not everybody, get better in their brain. The brain fog gets better when they get on Namenda, and so it's more of a we're finding a mechanism to explain it. And so it's not so straightforward oftentimes in biology and especially in the brain science as complex as migraine. And so that is the, it's not so clear. Yeah.
It would be nice, as someone with migraine, I would really like to have like definitive answers, have everything put into a neat box. But unfortunately, that's, it's just not the case. But
and so
we do the best we can.
Yes, and then so the magnesium, then we often put people on it, whether they have aura or not. So you can certainly see that might have equivalent or better efficacy than the Namenda. But whether if you do two together, there might be some synergistic effect as well. So it's when we don't know certain things because we lack of data, we can try things and kind of weigh the risk and benefit of trying these things. And Namenda itself, it's been around for a long time, treating Alzheimer's disease, and we know the side effect profile is pretty good. And we can try low dose and to see if there's improvement. So that is the approach.
Right, that makes a lot of sense. So a question we just had come in live is, does gabapentin also antagonize the brain fog? And then what happens if you take both Topamax and gabapentin? Would that go the opposite direction?
Yeah, so that goes to what I showed earlier is that on that, you will see that actually gabapentin is on that in the right upper corner. If you have that, you can take a look at that. So it is a suppressor of cortical spreading depression, thought to be. And then again, I also mentioned that Topamax is also there, and Topamax can cause symptoms similar to brain fog by over suppressing. So it's a matter of dose, and it's a matter of how the body reacts to both at the same time. So both can suppress in a different way by different mechanism, but both can potentially suppress the cortical spreading depression. So you can say that, okay, so there might be a class of cortical spreading depression suppressor that is more to treat the aura type of cortical spreading depression, but not the constant or the more prolonged brain fog. And so you can make that kind of separation and be able to better understand that. So it is really a kind of a trial, error and trial basis with any individual to try these things. So we oftentimes have to kind of work through these medication to see, starting with a low dose, gradually building up to see if each medication is efficacious for what the symptom.
Absolutely. No, that makes total sense. A question that we had last week come in was, are there other migraine medications besides Topamax that are commonly used for migraine that can cause cognitive impairment?
Yeah. There are a host of them. A lot of them. So that's the reason we use. We start small and go slow. And the typical ones that we think of are actually the tricyclics like amitriptyline, nortriptyline. Those things are quite effective for a headache, and they're also so they've been around forever, and they're still around because they're effective. And so we use a small dose to minimize the risk of cognitive effect. and its effect. It probably helps also if you have someone who doesn't sleep very well, and the tricyclics can really help with inducing sleep. If you have better night of sleep, then your cognitive functioning would be better and your headache would be better. So from that standpoint, then we're not in the higher dose range where it would cause cognitive impairment, and we're reaping the benefit of the
Right.
sleep-inducing effect. And then you have beta blocker and other antidepressants, similar concept is that, at certain range, then, you have to kind of weigh the risk and the benefit of the side effect and the benefit to
Right.
see, where you are and how we should proceed, what dose you should be on. So a lot of them can have cognitive side effects.
Right. Right. Which I think is obviously a frustration for a lot of people with migraine, still trying to
Exactly.
function.
Mhm.
A question we had come in live was, and it's kind of maybe a little bit outside your purview, but I'm going to ask you anyway. How would you recommend that we describe brain fog to friends and family? What would be an easy kind of layman's description that may make sense to someone who hasn't experienced it?
Mhm. Okay, I thought about this quite a bit, and as a memory doctor, um, we especially with dementia and Alzheimer disease, that is thought to be it's kind of defined as a progressive and kind of uh, irreversible disease, and in terms of neurodegeneration, we tend to think of brain, um, that cognitive impairment as a progressive thing. So when we come across more because of long COVID, this term brain fog, we kind of pause a little bit about, what does that mean? And so, one good way to kind of differentiate that from say, a cognitive impairment from neurodegenerative cause like Alzheimer's disease is to have the analogy that, everything slows down, but you ultimately get there. It's like email versus, snail mail.
Right.
And, when you do the email, it's, almost instantaneously, and that's how you usually function. But when you have a brain fog, the mail still gets there, but it's slow. And
Right.
everything kind of slows down and takes effort. You can extend that to all sorts of things, like you can concentrate, you cannot multitask, you feel just overall just very, kind of low in energy. And then you might not be able to figure things out when you're under pressure
Right.
and so forth. So that's how I would describe brain fog. And then,
Yeah.
of course, with migraine, you have other things. You can have dizziness and so forth, and that can kind of compound and make the so-called brain fog that we're describing worse.
Yeah, absolutely. That's an interesting description. I think when I'm thinking about snail mail, I'm also thinking, there are going to be delivery exceptions. Sometimes the mail gets lost. It
Right,
eventually gets found and it's delivered, but that's how it kind of feels in my brain. Just like, I know it's up there, but they just can't find it right now and it will
right,
come. And so,
right,
so I like the snail mail description because of that, because I really relate to that. And maybe some
mhm,
other people relate to that as well. Kind
yeah,
of going along those same kind of lines when you talked about permanent versus non-permanent changes. So one of the questions we have here is, let's say you discover a medication or therapy, or you go into menopause and you're one of those people in menopause who it gets better for. So your migraine reduces or almost completely goes. Does the brain fog and the cognitive changes, do they reverse, or is that permanent, or do we not know for sure?
yeah. So that is a kind of a loaded question. Depends on several things, and we
Right.
mentioned that hormonal changes can be
Right.
can cause independent of cortical spreading depression that
Right.
is associated with the migraine syndrome. And so, that also depends on if you, at that age, did you have a lot of kind of insult to the brain, such as traumatic brain injury, such as, chronic lack of sleep um, and, and so forth. All that will have to be weighted to determine whether the cognitive or the cognitive issue that you have beyond the migraine syndrome, whether that is uh, that's what it's showing. And then if so, then is there a neurodegenerative part to it?
Right.
And I'm very happy today actually because Eli Lilly, the clinical trial, if you pay attention to Alzheimer's disease,
Right.
they show their top line data today, and
Yes.
it's shown to be effective. It's the second medication in a year that has been shown to really slow down the cognitive decline in Alzheimer's disease. So there is a tremendous hope now with Alzheimer's disease and neurodegeneration, specifically in Alzheimer's
Right.
disease. And so, so I'm very happy that that has come to fruition. And so, so even if you have neurodegeneration at menopausal, and that's not necessarily related to the migraine, then you should get evaluated by a specialist and be considered for these therapies.
Right. Absolutely. Thank you. And yes, I saw that about Lilly today. It's great. They're going into final phases of studies for their Alzheimer's medication. So that's really fabulous news, obviously. This is slightly different, but kind of on the same topic. And I've seen this in our community by a few people. So they're saying that this person is saying that they're having a less frequency of what there would be like a regular migraine with the attacks, but they're still having brain fog. And we've seen that with some people, like they'll discover a CGRP medication and they don't have pain anymore, but they're still getting the brain fog, and they may get aura as well, but no pain. Is, what is going on there?
So that can be explained by what we've shown earlier with cortical spreading depression slide. So essentially, you have a sensitized brainstem, and then that can lead to headache or not. And it can independently lead to the cortical spreading depression without headache. So what you might be experiencing is just that. And then, so that's why you have aura without headache. So these things are separable. And the aura and the prodrome might not lead to a headache, but you have the spreading depression in prodrome and during aura. And so that by itself, causes neuroinflammation and so forth. And so that can be explained away by what we talked about.
Absolutely. Thank you so much. I appreciate that. So now we're kind of moving on to how to improve brain fog, which you covered a little bit in the last slide, or the next to last slide, where you talked about the, the activities, the brain activities, being social, all the other things. So one of the questions is, are there any supplements that can help? Like if we're looking at doing this naturally, is there anything that can help with that?
So when we talk about supplement, it's a kind of a reductionistic kind of approach, and we can think of it as taking out the effective ingredient or active ingredient in diet and try to concentrate that. But oftentimes that is not helpful. It's better to sort of have a better diet and try to get those substances from the diet. But having said that, there are a few things. And so we want to make sure that you are not deficient in any vitamins. And we want to make sure that you're not deficient, especially in magnesium that we talked about. And we want to, stay on, the data showing that, that oil such as olive oil, and also the limiting saturated fat, and also taking omega-3 supplement if you don't get enough from food such as fatty fish. Those things tend to be anti-inflammatory and quite important actually for brain function in general. So from that standpoint, you can kind of build your diet and to supplement your diet as needed.
Okay, wonderful. Thank you. Okay, we have two more questions, and then we're going to call it a day. So the first question is, I saw on the screen again that you have about keeping your brain active. Are there specific types of puzzles or brain games that you would recommend, or learning a language? Many people with migraine might groan at the thought of learning a language, but what I actually am, I'm learning a language, and I think that it's, and I do a lot of puzzles, I think it's helping my brain fog. But I'm not 100% certain that it is. So are there specific things that, brain activities that are better than others, or just anything?
There are some guidelines here, but we usually talk about social interaction for the reason that it's quite challenging for the brain. You have to understand the sort of not just what the other person said, but the intention behind it, and so the emotional aspect to it. So it's very complex when we talk about social interaction. So that is quite typical when we talk about interaction or brain exercise or activity that can be good. Certainly learning, piano, learning new musical instrument, learning a new language, all those things that challenge you mentally, and to be able to obtain new skills and new knowledge, those things can go a long way in helping you to maintain your cognitive health. And there are a lot of games out there that people might have come across, and the studies have typically shown that you only get better at the game and not the
Oh
function in
no.
general. That seems to be the case when you learn something that is more specific as to a game, then you get better at it. But perhaps what that means is that you have to play many different kinds of games.
Right.
To kind of reap the benefit that you get from a complex interaction, like a social interaction that you keep up. Yeah,
absolutely. Or you could do a crossword puzzle in a newspaper together with a spouse or a family member, right. And then that way you're like doubling up. You're getting the social interaction, and you're exercising that part of your brain. So exactly. Or you could learn a language and practice it with someone. So yes. You would that way you would get kind of multiple good things, right?
Yes. And so what's important is that you kind of have to enjoy it. If you don't enjoy it, there's really really difficult to keep up, and what's the point,
Right.
And so you kind of have to find things that you enjoy, and then be able to new things that you might enjoy, and then challenge yourself in that way.
Right. I love that. And I think that's really important for people here to hear, because people with migraine are told all the time what we should do. And a lot of it is very, very challenging for us. And so just want to affirm what Dr. Liu said, find something that you would enjoy doing. Don't let anyone tell you you have to do, the Sunday Times crossword puzzle if you hate doing that, but, find something that you enjoy doing and something new. So that's a great thing. I'm actually going to slip an extra question in before the last one. Someone asked, what is your preference for the best magnesium? Not the brand, but the best type of magnesium.
There are several types, and in terms of bioavailability, we typically talk about magnesium glycinate, magnesium citrate, probably better than the oxide, and so that's what I typically recommend. In particularly, the glycinate actually has a more of a calming effect from the glycine itself that kind of comes off as a byproduct.
Okay. Yeah. Interesting. Great. Thank you for that. And now this really is the last question. It's kind of a hot question, and I know we're out of time, so you can make it short if you want to. Obviously, on one of your slides, you talked about that the risks of dementia and Alzheimer's for people with migraine, or the correlation, not necessarily the causation, right?
Right.
So my question is, does that correlation or does that risk increase with the frequency of migraine attacks, the severity of migraine attacks, and or the length of time that you have been experiencing migraine?
Yeah, so that is controversial because the data some studies have shown that there's no very clear correlation, and some studies show that there might be. So we can only say that there's associated risk, and so perhaps it stands to reason then that if we limit the time you spend in migraine over your lifetime, perhaps that is going to lower your risk of developing dementia.
Interesting. Wow. This has been so fascinating. I hope that everybody here who's been watching and commenting today, and everybody who watches this video has found this really helpful. We would love to keep getting your comments on it. Let's enter into a discussion. Obviously, it's a really hot topic. It's so important and near to so many of us. So really appreciate your time, Dr. Liu. here today. Any last thoughts or last comments before we end this event?
I just want to thank everybody for being here today to listen to this topic. I think it's becoming more important as we learn that migraine is a syndrome, and then all these other non-headache symptoms we should pay attention to, because they really tell us what's going on in the brain. And then, by paying attention to those things, then we can significantly increase our lifetimes, in terms of cognitive health, and then kind of reduce the risk of dementia over time. So thank you very
Absolutely.
much.
Thank you so much for that. Migraine can be such a challenging disease to live with. As we all know, this is just one aspect of it, although a pretty big aspect. And so we encourage you to proactively partner with your doctors, explore different options. If you haven't checked out Neura Health yet, we definitely encourage you to. There is a link in the comments that we're going to put, so you can just click on that. They have an amazing team that addresses all the different aspects of migraine. And so we're appreciative to Neura Health for partnering us with this. And we do want to encourage you, to check them out and see if it's appropriate for you. Create an action plan to help manage your symptoms together with your doctor. Stay connected with people. And again, thank you so much, everyone, for being here today. We appreciate you.